All right. Welcome back to Bumbershoot, where we're covering life's chaos with humor and heart. And we are still in season 3 with our Charity for Charity beneficiaries. And we haven't had to detour because we've been on track now.
Yes.
I always say Brenda. I was just with Brenda at lunch, so that's what came out. Rhonda and Tracy. We're here back with you guys today, and today we have a special guest. We don't always get the actual beneficiary themselves. Yeah. We had Cass, but I think she's the only other one. I think
so.
Right?
Yes.
So today we have our adult beneficiary from this year's Stars of the Valley 2025, Jana.
Hey,
welcome, Jana.
Hi, thank you so much for having me.
Yes, we're happy you could make it today, and it's really cool because we're gonna get to it, but you just finished one of your wishes, so it's gonna be fun to be able to recap that so new and raw.
That's nice and fresh.
Sorry, we have so Jana's husband's gonna be joining us in a little bit. But he is not here yet. So we're going to get started without him, and then we might take a little pause, or we might just have him jump in while we're talking. All right. So, Jana, tell us a little bit about yourself.
Gosh, what do you want to know? There's a lot.
Well, how old are you?
I just turned 40 in March. And
what is that birthday? Is it it's a significant, obviously a milestone.
It's I don't know. I love the 40s.
40s are
especially
good.
now that I'm not in them anymore.
40 was the best year.
It was a good
year.
It was a good, not century, decade, guys.
Yeah, it's a good decade. You will enjoy.
Yeah, it's good.
I thought 30 was going to be the years. Or the decade, because my grandma was like, 30s was so good for me. And I'm like, cool, that's going to be it.
Yeah.
And then it ended up being the hardest.
Yeah.
So I feel like this new decade, especially because I actually made it. And I don't say that lightly, like I am here.
Yeah.
And I'm so grateful. So I feel like this has to be the decade. And
it is.
Kicking it off with Charity for Charity.
Yeah.
Come on, guys.
That's really cool.
Let's go.
That is cool. Can you make out with the microphone so we can hear you really good?
Sure.
Yeah.
There you go.
I knew Jana would respond to that. So
We need video.
I know. Okay, Jana, so you mentioned that last decade was tough. So why don't we just go ahead and start with that? So, your upbringing and all the things until you got married was all butterflies and candy and, right? Frolicking through the meadows.
I really had a special childhood, and we grew up on the coolest street, and we had over 60 kids, 60.
Wow.
Or maybe there was exactly 60, but those were the good old days. And then I went off to college and graduated, and we had our first when I was 24, and things actually, maybe it started in my 20s. Things were a lot rocky with that pregnancy. And
so you got married to Scott, and then you got pregnant, and it was rocky.
Yeah.
That's what you're saying.
So our oldest was premature, 2 months, born with sepsis, and it was wild and life-threatening for both of us. And she was in the NICU. She really overall has done very well. She's about to be 16. She's almost taller than me.
She's so tall.
Why do they think she got sepsis?
Oh, that's a story.
Okay.
So
Are we going there?
we can go there. Okay. So let's see. She tried coming, or my body tried evicting her. I don't know which.
Eviction on the door.
She started, I started contracting at 18 and a half weeks. And so I went into labor, and they weren't going to stop it because I wasn't 20 weeks. But by the grace of God, she measured 20 and a half, at which point they intervened and said, this pregnancy is viable. Your baby may not be, but your pregnancy is, which was kind of confusing to me, but those were the words that...
What does that mean for people that don't know what viable means?
We can probably save the pregnancy. We'll see if we can also save the baby. So they admitted me, gave me all the meds to stop the contractions and stuff like that. So they stopped, thankfully, We were released a few days later, and then she almost came at 24 weeks, 28 weeks, and then at 30 weeks is when it really got crazy. And I kept going into the doctor, and I'm like, something's wrong. How much am I allowed to say on this podcast?
You can say whatever you want.
I'm like, something's wrong. Like, I'm telling you, I'm leaking fluid. I'm leaking amniotic fluid. I got the same nurse every single time. No, honey, this is your first pregnancy. You're fine. You're just peeing your pants.
Why couldn't they test it?
They could.
Because there's a difference.
So we went through this with the same nurse in triage multiple times. And she claimed to have done the test, which we found out when my perinatologist finally came back in that she did not do the test.
What?
It is.
Wait, what kind of doctor is that?
Perinatologist.
What do they do?
Perinatologist?
Perinatologist. So it's when you see like a high risk OB.
Oh, okay.
Yeah.
Thanks for dumbing that down for us.
Yeah.
Thank you.
No, you're so good. There's probably a lot of.
Yeah, we're going to have to catch you a few times through all
That's
these.
it.
I'm going to be Googling words.
Yeah, Tracy's good at like searching things for us. That means.
Yeah. So the doctor did a particular test, and she's like, "You're leaking fluid. What are we doing? Go to the hospital now." So this is the funniest part. Well, it's funny now. It wasn't then. But my mom had been out towards the desert with us, and she goes, "I just had this feeling. You know, I had been out there. I was taking care of you. Scott was working graveyards, and I just knew that like this baby was going to come. Something wasn't right. So I just went down to Cabazon, and I decided to just go shopping. And sure enough, you call me."
No way, I got chills.
Mamas always know.
100%.
Intuition.
So me being a first time mom, 24 years old, I call my mom and I'm like, "Mom, she's coming. I need you to go get my diaper bag.
Oh, yeah.
We're going to need, I don't have any preemie clothes. We're going to need like newborn, 0 to 3 is probably not going to work. Like all these things, bring me a diaper bag. Like this child is going to go home 2 months early."
You probably don't need anything, really.
Yeah, no, it's just not going to happen. So we got over to the hospital, and the head of neonatology, so the neonatal,
that word we can put together.
Yeah, that makes sense.
Neonatology.
Yes.
he says, "No way. Like, this isn't happening. Baby isn't big enough. Her lungs aren't developed. We got to get this mom further." So my perinatologist kind of sat on it for a minute, and
your parent was on the way from Cabazon.
yep, sure was.
Stop shopping and
Yeah. And long story short, I got to the point where I couldn't handle the monitors on my belly to monitor her heart rate, her movement, all these things. So at that point, my doctor stepped in and she said, "We're done. You can fire me, but I'm going to save this mom and I'm going to save this baby."
And how many weeks you were at?
The day she was born was 32 weeks and 2 days.
Okay.
Yep. So again, by the grace of God, she should have only been 2 to 3 pounds. She weighed 5 pounds, 4.8 ounces.
Oh, yay.
Yeah.
no way.
Yeah. And they said if she went to term, over 10
huge.
pounds, over 24 inches.
Jesus
So-
loves you. This we know.
Yeah, that's a toddler.
Yeah. And you're tall, and she's super tall.
Yeah.
How long was she?
Oh, God. Let me
you
think.
remember?
She was 20 and a half inches.
I was going to say she probably
yeah.
was.
No.
like
That was her
20
sister.
over
She was
20.
18 and a half.
That's
Okay,
huge.
but that's for that
Yeah,
early?
Still, those are long
Yeah.
babies
Yeah.
for premature.
Yeah, for sure.
Yeah. So she dropped to 4 pounds even. She did struggle, but she overall, I mean, if you saw her now, you would never know.
No, you would never know.
You would never know.
Nothing.
I didn't
So
know.
she was born with sepsis because I was in fact leaking amniotic fluid. So I ended up having a really bad infection for 11 months after that. I mean, it was bad because they thought they gave me enough antibiotics and they didn't. So the whole inside of my uterus was still infected, and it was
Oh my
gnarly.
gosh! So it's a miracle that she was okay.
Yes.
And then
I swear, is this not like a pattern that
It's a pattern.
the doctors need to listen to these
Yes.
people?
Yes, please.
Moms, listen to the moms. Doctors, listen to
We
you.
know
the
our
moms.
body the best.
I know.
Sometimes, yeah.
Even though you never had a baby before, you knew.
New.
Yeah. Yeah. I mean, there were other things too that, I mean, I don't know how you could ignore what I was going through, but they did. And so she was supposed to be in the NICU at least 2 months. She was out in 19 days. And then she was on an apnea monitor for 2 months.
Wait, was she released early because
She was
they
big.
didn't want to keep her, or because she was doing good?
She was doing phenomenal.
Okay, great.
Awesome.
That's
Yeah.
good.
We have this one picture of her, and she's in her little, what do you call it? It's like what they give them a bath in the NICU, but it's not like a full tub.
Yeah.
I kid you not, this kid looks at us. She starts to roll over and grabs a side, and her leg is hanging out.
Oh my God.
And all of us in the NICU nurses are like, you can't do this. Like, you're supposed to still be in the oven.
Yeah.
And she just had this superhuman strength. And
Oh my gosh, she's a fighter.
yeah. And then I really don't talk about this, and here I'm going to put it out on a podcast, but I feel like it is becoming more common to be spoken about. And I think it's really important. And so, given our journey and the isolation through it and the hardship through it, I did end up with really, really severe postpartum depression.
Oh, God.
And that is, I mean, it's next level when you have this teeny
baby,
tiny
yeah,
little
depending on
baby
you.
depending on you. And just at the time, it was just like, God, this isn't how it's supposed to be. But he knew what he was doing every step of the way. And he used all of it.
Wow.
So, yeah, that's my story with my oldest.
Oh, and there's more?
There's more,
But wait, that's not all.
but that's not all. Charity's favorite line.
That's right.
Yeah, so then we said, we're done. We're never going to try again. That was crazy. She's amazing. She's the greatest blessing. And then probably a year and a half or two later, I don't know. I don't like math.
Neither do we. That's a funny thing.
Yeah. We're like, oh, well, babies are really cute. We should try this again.
You forget
why
everything
not?
they say. Yeah. That's what they say.
Yeah.
Forget it all. Let's do it again.
Yeah, so we tried again, and that one is in heaven. And it was pretty early. So, and at the time, we thought that my body was hopefully at the strongest that it could be. And in between that, I had some orthopedic surgeries and some malpractice, frozen shoulder. Like, that was pretty brutal. But anyways, we tried again. And then we got pregnant with our second Earthside. And we thought it was going to be easy, smooth sailing, and I was on total bed rest by 9 weeks.
Oh, jeez.
Wow. 9 weeks.
9
That's
weeks.
early.
It's really,
Yeah,
really.
I laid on my
Some people don't even know they're pregnant at 9 weeks.
No.
Yeah.
No, I laid on my left side the entire pregnancy. We had to hire a nanny to take care of my oldest and I while Scott was working. And
I think he just rode up.
the crazy thing is,
Rode up? Drove up?
yep, there he is.
Is it?
The crazy thing is, we didn't know where we were going to find someone. And
Because you were living away from your family?
no, we were back in Orange County at this point, but just to have somebody in your house that's going to be doing everything for you and taking
Sounds
care
lovely.
of you. Yeah.
Sign me up.
Taking care of your toddler, and then back and forth with doctor's appointments. Like, it was really just a lot.
Yeah, that's a
So
lot.
some friends recommended a girl, and she came over, and we said, well, what do you charge? And she looks at us and all her sweetness and joy, and I still feel this way about her, and she goes, I just want to bless your family.
Oh, God.
And we look at each other and we're like, who says that?
An angel.
Yes.
A God sent.
Wow.
And she, to this day, is still our girls' godparents. And
Oh, my God. I love
Yeah.
that.
Is she the one that came to the gala with you?
no.
Okay.
This one, she's actually in Ohio now.
Oh, okay.
She has a podcast of her own.
Does
Oh.
she?
Yeah.
Oh, that's so cool.
She does.
So she took care of you guys for free? Didn't charge you?
I think she ended up charging us like $9 an hour.
I was going to say, or maybe you just paid her something.
Yeah, like tipper or something.
Yeah, no.
Well, wait, why? I mean, not that you're not worth it. I'm just wondering what made her, did you ever find out why she felt that, to give that?
She just felt prompted by the Holy Spirit.
Oh, wow.
So
That's pretty
That
cool.
was her job. It was full time. And that's,
yeah.
so she wasn't making any money, obviously.
Is she
Besides what you guys
older?
were doing, or-
No, she's younger than me, but she had
Wow.
just graduated college and just gotten married. And
Didn't need to work, maybe bring
I mean,
in
she
a lot of
needed
money.
she needed to make some money, but she was just like, hey, whatever you want to do, like I'm here for
Gosh,
it.
that's like, we can't wrap our
I know.
brains
I'm
around
like,
it.
hey,
What an angel.
She really was.
and in
an
Orange
angel.
County?
yeah.
Yeah, exactly. It's a different level out there.
Yeah, for sure.
It's crazy.
That's so sweet.
Scott would remember the exact amount, but I think it was close to that. Yeah. So then with Bryn, I didn't want to say her name.
It's fine. You didn't really.
It got real crazy. So at first it was just that my body was rejecting the pregnancy, couldn't handle it. And then we went in high risk, of course, again with another perinatologist. And it turned into, hey, you have a tumor on your left ovary. We got to keep an eye on this. So
How did they find that? An ultrasound?
ultrasounds,
Yeah.
yeah, and pain. And then 1 turned into 2, which turned into 3, which turned into 4, which turned into 5.
What?
So then we were just trying to get to 16 weeks to start a particular medication to help keep me pregnant because I had a premature delivery before. So that lasted only 3 weeks once I made it to 16 weeks. And they had put me on some other stuff too, just trying to keep me pregnant. And I remember the doctor just saying, well, it's up to you now. I'm like, what do you want me to do? Like, I'm doing everything else.
What can I do?
You got to save this pregnancy and this baby.
All right, let me talk to myself real quick.
Yeah.
Right.
So I was committed to just laying there and staying pregnant, and laying there that long was
Oh my God.
Yeah, that's
a long time.
I can't even
Hey,
imagine.
Scott, come on in.
Hey.
Look at he's creeping in. Why are you creeping? Wait, you can talk. It's fine.
So it turned into 5 tumors. They kept watching them. They kept growing. At one point, Scott said they looked like Mickey Mouse.
Wow.
And then the ultrasound tech was like, I can never go to Disneyland again. It's just not going to be the same.
Well, that's not no
Yeah.
harm, no foul.
So it started to cut off the blood supply in my body. And
wow.
I started to collapse while I
the
was
tumors
pregnant.
did.
Mhm, yeah, because they were so big. So the baby's growing, the tumors were growing so fast. And then I think it was 26 weeks, 26 or 27 weeks in 2 days. It's always 2 days. It's weird. They decided to take them out, and they were big enough and tucked in far enough and trying to keep a baby where the baby needed to be and all the things. It took them 3.5 hours just to get the tumors loose. So that was pretty wild. And I did go into labor, which would have
During
been,
the surgery? Oh, shit.
which really, really would have been crazy and just not a good situation. She would have been a micropreemie. We later found out, she had a couple heart conditions. And so, I mean, again, like all God's hand on this story.
Yeah, such miracles. A miracle after miracle after miracle.
It really is. It really is. So they were able to stop the labor. They kept me asleep, and I woke up and I was still pregnant.
Yay!
So they said I would have make it even to 28 weeks. 28 weeks would be icing on the cake. And lo and behold, they induced me at 39 weeks.
Oh, that's awesome. Wow, that was a longer one.
Yeah. So
That's good to hear.
Hey, Scott, welcome.
Hi, Scott.
We're kind of getting him adjusted. He's sitting down, getting closer to the mic. You got to make out with the mic.
does your head fit?
Oh, it's going to take him a while to extend the headphone.
Good enough.
There we go.
There we go.
There's Scott.
Nice.
Sounds good too.
Welcome, Scott.
Welcome.
Thank you.
We're talking about pregnancies, nannies, bed rest.
Yeah, we
Yeah.
just got through the second pregnancy. It was really rough on us.
It was.
It's rough on me too.
She delivered a lot of things of that pregnancy between
Yes.
tumors and babies.
Yeah.
Yeah.
All right, so we had our second one all together, guys. we had our second baby, guys.
Yeah. So we had her, and it was actually the funniest birth ever. And we were told that, like, we've always wanted 4 kids, and obviously God had different plans. And so it's going to sound so silly, but I really, really wrestled with it. And I just prayed and prayed. And I was like, Lord, if this is it, I need the clearest sign. Like, I know maybe this sounds manipulative, but I need it to like brown hair, blue eyes. I'll drop it.
Oh, we were specific.
It happened. No.
Oh,
And I was like,
of
dang
course
it.
it did.
I guess we're really done. Scott, do you want to adopt? So then he got me a dog.
Oh, that was a great midway alternative.
Yeah.
Yeah. So we thought it was going to be all rainbows and butterflies, and it was. She was the funniest baby. Oh my gosh, she was so good. And it was truly the most beautiful delivery.
And were you okay after that? I mean, immediately after that, like you didn't know.
After the delivery?
Yeah, like you got the tumors out, you had a baby, and now you're like, I'm going home to my family and everything's fine.
Yeah.
I can't remember.
It's just always a party.
Well, I'm just saying, I know things. I know that's not all, but I'm saying like immediately did we think that everything was fine?
Immediately, gosh, no one's ever going to listen to your podcast again if they know the whole story. So
Yes, they will.
So her umbilical cord actually snapped in half.
Oh, you're gonna.
I'm not gonna say
You're going to
all
go
of it.
there, are you?
You're going with this.
But so when that happened, and maybe I'll tell you the details another day. I don't mind sharing.
Was it a C-section?
No.
Oh gosh. Okay.
No, and so
Did it snap you?
Like a bungee cord.
right?
Right back.
I'm just wondering if it came back on you.
I'm looking at your life.
Well, I did have lunch with Rosie earlier.
Yeah, so it did snap. So that made some complications after the birth. I think probably the best part about the birth though was I didn't realize that she probably would have been born sooner. Like I didn't realize I was transitioning, and they're giving me an epidural, right? So like they're barely catching this epidural, and I'm looking at him, and my perinatologist is going, Jana, if that's the face you're making, like you're not pushing. And I'm like, yes, I am. Because they had to keep giving me more and more and
Were you
more.
laughing at him or
It was
cringing at him?
No, I was just so happy, and it was beautiful.
What was she doing, Scott?
And he looks over at me, and what did you say?
What did you say,
I
Scott?
said, yeah, that's not your pushing face.
But I really thought that I was.
What is your pushing face?
I don't know.
We totally.
And what face were you doing?
I mean, I think I was doing that.
No, she was sitting there just kind of smiling and like, it was very different. So her doctor kept telling her, okay, you need to push. She's like, I am pushing. And she was just.
Well, you had an
sitting there
epidural at that
smiling
point,
and-
yeah?
Well, and they had to keep giving it to me, and they're like, this doesn't make sense for like your body weight and everything. Like you shouldn't need this much.
Well, clearly you were fine because you were smiling.
Smiling away. It was a good time, but
So can you tell us why the umbilical, because I mean, obviously when the baby comes out, we cut the umbilical cord. So why, when the baby's coming out, the snapping, why is that not?
hers broke in half. She did it herself. So
Right, yeah,
hers,
but why is that not okay?
hers was literally like as thin as my pinky. Like for some reason it was very, very tiny. So for whatever reason it broke. And so then we have this resident and she looks up at the doctor and she's like, doctor.
The dad doesn't get to cut this one, guys.
No.
Oopsie.
Look at this. And the doctor looks at her and he says, go in and get it.
Oh,
And I'm like,
You're like, no.
where are we going?
Wait,
Where
wait,
exactly are we
wait.
going?
Okay, wait.
Don't
Let me
go
just
in
think
and
about.
get it.
Sorry if we're getting people grossed out, but when the baby comes out, the umbilical cord's still attached,
Yes.
even through the not stomach.
Because the placenta should come with it.
Oh, and then it just releases it.
so the
But yours got snapped and the placenta didn't come.
Fully attached.
Oh,
So it's attached to your
that's why it was
that
a
makes sense
problem.
now.
So now more than ever, I'm like, praise God. I had an epidural
Yeah.
and that you gave me way too much.
Yeah.
Yes.
Yeah.
And I'll leave out the rest of the details.
Okay. Yeah. That's
But how much did she weigh? Because you went almost full term with her.
Yeah, so she was 7'7".
oh, she was
Okay,
nice and
that
healthy.
wasn't bad.
That's a big
Yeah.
I think
I was
that's what I was.
expecting more. I was expecting her to
be bigger.
be bigger because
Yeah.
your first one was
Right?
anticipated to be.
Yeah, 7'7", 20 and a half inches.
Oh, yeah. That's
yeah,
like
that's perfect.
Perfectly
That's a
average.
good size. Yeah.
Yeah.
Okay.
Yeah.
All right. So now we got 2 kids.
Yep.
We're home.
Yep.
And then what?
We thought it was going to be good.
Yeah.
We thought it was going to be easy. So she was born in March, and August 1st, I had an emergency hysterectomy. They thought that I had ovarian cancer. And So I was sent to a gynecological oncologist.
Jeez, these words.
I know, right?
Gynecological.
Oncologist.
Gynecological?
I'm with her.
Gynecological.
I need to practice that one.
He was fabulous. He's a guy. I adore him. And so that was that. And they, I'm leaving out a lot of pieces, but they left my right ovary. And I fought with that sucker for 11 months. They took everything but my ovary. And so 11 months later, to the day, Scott had gotten home from work. He was sleeping, just worked graveyards. And I woke him up. I'm like, something is wrong. Like, my abdomen is so hard. I'm in so much pain. We got to text the doctor. So we text the doctor, and he's like, you need to come in immediately. And within a week, I don't even think it was a week, he took out my right ovary. And 2 weeks later, I got pancreatitis for the first time. We have no idea why. I do have some anatomical abnormalities, like I was born with it. We have no idea. And so from that point forward, 2014 to 2016, it was real rocky. I was in and out of the hospital for weeks to months weeks to close to a month at a time.
What is pancreatitis? We're saying you had
Pancreatitis.
pancreatitis. What does that do to you?
Oh, God. Imagine, sorry, listeners again. Imagine a light pole. Like,
Do I need to put like a little clause on our thing? If you have a sensitive stomach, do not listen to this podcast.
yeah, it's real medical. Imagine like a light pole going through the front of your body and coming out your back, kind of at like the bottom of like your bra level. It is the most horrific, like, gnawing pain. A lot of people will mistake it for even a heart attack.
Oh my God.
So you had contractions, and that's worse.
Pancreatitis? Oh, by far.
Oh God!
I would rather birth like triplets.
Oh my God!
Jeez.
Yeah. And then on top of that, like, then you can't eat, you can't drink. And so it would be extended periods of time of just fluids, IV fluids. So they ran every test under the sun, trying to figure out, like, what is the cause of this? And people generally will jump to, well, when was your last drink? And that's my biggest pet peeve.
Your last alcoholic beverage?
Yeah.
Because pancreatitis is generally
Yes,
because-
related to alcohol.
Related to alcohol.
lots of-
I
I've
didn't
heard
even know that.
Yeah.
I knew liver disease was, but I didn't know pancreatitis.
Oh,
I've
yeah.
heard that before.
Like, even now, like, the first thing I say if I have to go to ER for hydration, it's not from alcohol. Don't ask me.
Right. She doesn't drink alcohol, which we'd like to give a toast to Pogigliano wine.
Yes.
Cheers.
Thank you for sponsoring
drinking
us.
water with
and water and
So I
the,
got the branded
and the
water.
water. No, but yeah, no, they don't. No, you don't drink anything.
I wouldn't either if there was a chance of pancreatitis again, because once you get it, can't you get it?
Yeah.
But you never drink.
I would have like
Did you?
a margarita or mojito like here and there, but
That's not what caused it.
Yeah.
No. Mm-mm. So, yeah, he would bring the kids. We have so many pictures of them just laying in hospital beds with me. And
So this was unrelated to your pregnancy issues.
yeah, I mean, for a minute they were kind of like, well, I mean, you're only 28 years old. Well, 29 when they took my last ovary. So I was 29, and they're like, well, maybe there is a hormone component to it, but we don't know what it is. So it's just really unknown. But knowing that now that there's things that I was born with, like with my, I'm gonna get all scientific, but my pancreatic ducting, when I would hold my babies, I could never hold them in the front. It would, well, I mean, I could, but it would hurt really bad. So I didn't do it often. I would always have them on a hip. So
Did you have pain in your pancreatic area before kids? Like, has that ever been a thing for you?
not like when I was diagnosed with true pancreatitis.
Okay.
Yeah.
So these things kind of evolved.
Yeah, for sure. Mm-hmm. Yeah. So then we had a doctor up in Orange County that contacted one of the top 3 pancreatic doctors in the world at midnight. And so every time he sees me, he's like, I'll never forget who you are. You're the one I got to call about.
Your midnight call.
Yeah. I have this 29-year-old I can't save. It's your turn. So he ended up well, I had a couple ERCPs, which is another conversation, but basically they end up stunting or cutting the duct so that the fluids and stuff can get through. So he did that in February 2016 and saved my life. Wow. And so then we went through some other stuff with it, and they ended up taking out my gallbladder, all that. But then we moved out to this area in 2017, and it was just a giant leap of faith because I was good for, I don't know, 9 months, a year.
Almost a year.
Oh, yeah, that's good.
Knowing that we were probably still going to be commuting for medical care.
Yeah.
Mm-hmm.
And like I would still have trouble here and there, but yeah, 2019, so we'd been out here for 2 years, was when it really, really unfolded and got crazy. And it's just never been the same since.
So can you give us a rundown of what the crazy part was?
All right. So
She's all da 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 da.
how much do you want to know? So we were dealing with pancreatitis. We were dealing with gastroparesis, which is stomach paralysis, which could also contribute to pancreatitis because then your food is just sitting in your stomach and your body is trying to release these enzymes to digest food that's sitting in you from morning to night. So we had that component. And then I was also diagnosed with an immunodeficiency. So that's like a whole nother thing. Basically, we just have to be really careful about who we're around if they're sick. It's a risk for more so for my lungs than anything. So I started treatment for the immunodeficiency in May of 2019. I also had the pneumonia vaccine, and then I was never the same. So I know that can get a little touchy, but
we've already said how we feel about these things.
yeah,
You can say whatever you want because everyone gets to think for themselves.
yeah,
You know, so it's whatever.
Yeah.
It's your journey. I'm not here to tell you you can or cannot say something.
Yep.
If you feel passionate, people should look into it.
yeah. It was
right.
more. They do it backwards though, because it was more of a test of what strands of pneumonia was. How do I phrase this? Would my body be able to fight versus which ones could it not be protected from? So,
Okay.
and then I started IVIG treatment, which is IV infusions of thousands of donors' platelets. I always mix it up. Plasma platelets to give my body the.
Her face. She leans over Scott with big ol' eyes. She's like,
What's the word?
what are you trying to
Antibodies.
say?
I got it.
He's all, I don't know what you're trying to say.
No, it's weird too because like some of it that's like traumatic, it'll just like, but it'll come back. So yeah, to give my body the antibodies to fight off these infections because I was getting like back to back to back, and then antibiotics do a whole thing on you. So
Yeah.
So we were dealing with that.
All these double-edged swords everywhere.
Yeah,
Exactly.
100%. There's a side effect to everything.
Yeah.
Everything.
You really have to weigh your odds when you
Yep.
decide to.
And at this
Do
point,
stuff.
I would have I'd be very hard pressed to do it again, but we'll get there. So, so they started the IVIG, and within 4 days, I was in the ER, and they thought that the treatment had caused kidney failure. But then they ran my numbers, and they said, "Well, you have pancreatitis," and I said, "No, I don't, because I can't feel it."
Yeah.
And then they showed me the numbers, and I said, "Oh, I have pancreatitis."
Oh no.
Wow.
But you couldn't feel it because of your numb stomach. What's that thing you said you had with the numb stomach?
Oh no, that was separate.
Oh,
I just didn't.
It's really hard to follow all these things.
No, it's. I know it's really a lot. It really is a lot, and
But think about a little. Okay, so you can't see Jana. I will post a picture of her or a few pictures, but she's like, what are you, $120?
Yeah.
She's probably 5'9", $120. She's like tiny
Cutest.
little thing. Yeah.
Super
You're like,
cute.
how does this
Super.
little tiny body take all this stuff?
Yeah.
And she's not even done. That's not all.
But that's not all.
That's not all.
But I wasn't always this tiny. It's because of this disease, but we'll get there too, because it's just really wild how it comes full circle. So, yeah, so that was that. And then they switched me to subcutaneous infusions, which means like little needles. There was, if you were at the gala and you saw one of the pictures in my video, I had my feeding tubes and then my there are these other little things. So it basically goes into the
Like the muscle or so, it's right below the skin.
fat?
Yeah.
I don't know. It just goes right under the skin. We did that for a while. But then my pancreas kept getting worse. So I said, okay, with my immunologist, I said, we got to figure something out because we don't know what is causing this. And nutritionally, like that's got to come first. Because I don't have my nutrition, then
You can't get better.
Right.
immunology doesn't matter anyway.
Right.
So that escalated. I had another stenting of my pancreas for time's sake in September of 2019. So we went from May to September. I had that done in September. I was in the hospital for 2 weeks with pancreatitis because it can also give you pancreatitis having it done.
Of course it can.
Yep.
Of course it can.
My numbers were still so high in the thousands, they could not bring them home or bring them down. So they said, okay, well, let's release you. You'll be more comfortable at home. We'll figure it out from there. So I continued to lose more and more weight. I was probably down, well, by the time I got my first feeding tube in January, I was down 30, 40 pounds. So I had my first feeding tube placed in January of 2020, and it did not go as planned. They nicked a superficial artery.
Oh
Yeah, it was truly catastrophic.
Oh my gosh.
no. God.
And again,
Can you believe like all the things?
What in the
And we're not
actual-
even done yet, guys.
That's all
We're
I
not
have to
even
say
done.
right now.
I'm like, how much time? So again, by the grace of God, I've never seen him go white. With what he deals with at work and everything, I've never seen him go white. And I just remember telling him, Scott, I'm freezing. Something is wrong. I'm going to spare you guys the details. And then, well, I can't with the next part, but I just remember him saying, nurse, nurse. And I remember the nurse screaming, again, by the grace of God, here comes my doctor and the anesthesiologist coming out at the exact moment. And he just screams, Jana's bleeding profusely. And they just come running. I remember them looking at each other. And then I was out. I don't know what happened after that.
Where were you bleeding from?
My abdomen. Yeah.
Your
so-
feeding tube?
And there's
It's like a minor
Yeah.
procedure caused
dear
all that.
Lord.
That is so
yeah.
horrifying.
Peg,
Oh my gosh.
Peg J
Poor
feeding
thing.
tube. So that turned into like this gnarly infection. So they replaced it in March. I'm still losing weight.
And March was when everything closed down.
Yeah.
So now you're on like
yeah.
total buckle down mask. Nobody can look at each other.
And my whole team is in Beverly Hills. And we're out here.
And nobody can go in the room with you and all the things that come with
I mean, at least there was no traffic.
COVID. Well, that's true.
That's thinking positive.
There we go, Scott.
I love that.
And then the first one too, oh my gosh, I couldn't even get out of bed because the infection's so bad. Like I could not stand up. It was so bad. He's trying to rush Adeline over to Rady's because she's getting admitted, taken by ambulance down to Rady's to be admitted.
For what?
She was patient 0, I think.
We joked that she was patient 0 because she had
What does that mean?
she had
She had COVID.
she had an
We don't know if she did.
it wasn't well they called it an unidentified upper respiratory infection.
Oh,
And this was in
That was in March.
January.
of 2020.
I was
they didn't know.
also
Before.
extremely sick in January 2020.
Maybe you were patient 0.
I might have been. We'll have to compare dates later.
I like that. I like what you call it.
I know. I've never heard that. That's
kinda
hilarious.
cute.
Yeah, so his mom's trying to get to him to go be with them. My mom's trying to figure out how to get to us. So our youngest kindergarten teacher is rushing over to take care of me and Bryn. Like, I mean,
those are the best.
Our neighborhood started kicking in. Like, it was wild. So yeah, so March they replaced.
Community.
It's
Love that.
so it's
Love
so
community.
important. It's everything. So they replaced if you want to get technical, they replaced the Peg J with a GJ. So
Oh, we totally get that.
I don't even know what that is.
the G port is it's actually really important. The G port is to vent your stomach if you have gastroparesis, the stomach paralysis.
Oh, yeah.
Okay.
But I was actually fed all the way down into the J, which is into the small intestine or the jejunum. So
okay.
that was
guys.
that.
Interesting. This is
So-
educational.
Yeah.
We're never going to remember any of this, but
It's okay.
Go ahead.
Someone's going to listen to it though.
We've got it recorded. We're
and
good.
they're going to be like, hey, I know what that means.
We're recorded for life, so we're good.
So that one failed. So they put in a third one in July, and it didn't work. So I got my
Were you hospitalized were you a hospital victim during COVID, or was it just like an outpatient thing?
I have to think. I had a home nurse. she came at least twice a week.
Oh, that's good.
Yeah.
She was amazing.
Oh, that's
she was
amazing.
so good. We had some really terrible
Good.
ones, and then we had an amazing one, and
Oh, good.
I owe her my life.
What a blessing.
Yeah.
Yeah.
So they took that one out in July, and maybe I got my PICC line in July. Anyway, July, August, somewhere. The tube
She
came
can't
out.
remember what her PICC line, her feeding
I got a
tube,
PICC line.
her umbilical cord.
I know, right? They got me up to 140 pounds.
That's good.
But TPN is really, really hard on your body. That's how they feed you through your PICC line. And so it was actually worsening my pancreatic disease exponentially. I cannot even go into how hard that was, and just the things going through my head, and like, how are we actually going to survive this? Because this is truly hell on earth.
But you actually almost didn't,
Yeah.
right?
No, it was really brutal. It was really brutal. And Christmas was definitely the hardest. I have just the most vivid memory of watching our girls decorate the Christmas tree. And that should be just a time of family and joy. And I hope if they ever listen to this, they fully understand.
Again with the tissue.
But I remember
every time.
I remember watching though, and I'm just like, finish the tree. Because I was running to the bathroom like literally every few seconds because I was so physically sick from the TPN. Not to mention, they also sent the wrong patient's TPN. That's for another day.
Shoot.
Yeah.
Oh, no.
Yeah.
Poor thing.
And thank God he was home because air was running into my line, which runs straight to the heart.
Oh, cheapers.
Yeah, it would have been bad.
So you were sitting there. So you were home
Yeah.
and helping the girls decorate the tree. And you were sitting there looking, going, I just want you to finish the tree because you wanted to see.
because I was in
Then
absolute
finish it?
No, I was in absolute misery. Like, finish the tree, get it over with, because I'm done.
Oh, okay.
And to
And
even
then Scott, did you know she was in pain?
Oh yeah.
You
It
knew.
was-
So you were like trying to pretend like everything's
Trying
fine
to kinda
with the
keep it,
girls
yeah,
and then
like-
help her back and forth. And,
Yeah.
Okay.
and that's not me. Like, anything I can be a part of with my kids,
Right.
like, I'm all in.
Yeah.
They're why I live and breathe. I tell them that constantly. Like, that is why I am here. Like, that is why I am here. So it got progressively worse with that. And so at that point they said, well, we have two options. We have a permanent J tube, which is straight into the small intestine and it's permanent, or you can have an NJ tube, meaning I had a tube in my nose all the way into my small intestine. So
Temporary.
NJ is temporary.
Yeah.
Should only have it 4 to 6 weeks.
Okay.
I had mine 4.5 months.
Oh, sheesh.
Wow.
Yeah. When they said J tube, I was like, no, the first 3 tubes did not heal. I could not even get down on the ground with my kids. They're so painful.
How old were they at that time? 2020. December.
They were 10 and 7.
Yeah.
Yeah.
Okay.
Yeah.
So that's middle school? Early middle? No, elementary, middle
elementary,
school, maybe.
Yeah. But they were so good through all of it. They have the biggest hearts. They're so compassionate. Like, they are truly angels on earth. And I remember one friend came over and he was praying over our family. And at one point he's like, Jana, there's nothing to worry about with your kids because someday they're going to end up being angels for someone else because of this. And I'm like, cool, but like, knock it off. Like, can we have a break?
Right?
Because I just want them to have a normal childhood.
Yeah.
But honestly, like, what is normal?
Well,
Yeah.
and when it's your world, you don't know the difference.
Yeah.
It's your world.
Yeah. And
Everybody's got their own story.
so as our story progresses, I feel like his words, I mean, he was so right. Like, he was so right. And it was actually his wife that came over, whew, bless her soul, and we had to pull out my NJ tube through my nose out of my intestine.
Oh my gosh.
Sorry, listeners, I'm sorry. And she did it.
Was that
Oh,
painful?
gosh. I don't know if I'm that good of a friend.
Is she a nurse or any
To be
experience?
honest.
She just like, we're doing this.
She is just another angel on earth.
Gosh.
Yeah. And I remember my doctor when
Guys, don't ask me to do that.
when my doctor
I would do
said,
it for you.
I would do it for you.
I would do it for you.
Oh, thanks,
too.
guys.
I would.
Oh, good. You'll do it for each other.
Get some gloves and keep home.
Do it for each other. It's like A circle of.
I'll pray over you.
Okay, well, we need that too. So
Okay, good.
That's good.
Yes.
That's a good friend.
she
That is.
she is.
I'd probably do it. I just take a couple glasses of wine.
You just need some gloves.
And I take close your eyes. I'm going to close mine. 1, 2, 3. It's like a Band-Aid, right?
I'm not gonna lie. I think it was a struggle for her.
Yeah.
Oh God, yeah. I mean, that's because how long is
Is it like a Band-Aid?
It's long. It's long, right?
I'm 6 feet tall.
Yeah.
It was 5.5 feet long. I measured it. I have a picture of it.
You just did it slowly,
Jeez.
right? Just pulled it out slow, or?
No, you actually have to go fast. And the doctor,
Gosh.
the doctor was like, "Have your girls do it." So he's working overtime.
No.
No, I was like, hard pass. You're a doctor. Like, maybe your kid can handle it. Mine had been through enough.
Yeah.
And then when my friend pulled it, I was like, there's no way in heck. So he was
No.
working overtime.
gosh.
And again,
He's all take overtime, guys. I'll take it.
he
got
didn't
you.
even,
I didn't even know it was happening.
he had no idea that it had to come out. So then he calls me, and again, there was a picture of this in my video at the gala, and he's just like sheer joy, like, what? You don't have a line in your body for the first time in 14 months. I didn't have food or water or I didn't have water for 6 months by mouth. I didn't have any food for 14 months by mouth.
Wow.
It was gnarly.
Oh my God.
So you were rejoicing. What a
Yeah.
beautiful thing.
But then he goes,
to.
wait, they said you'd never be able to eat again. What are you going to eat?
right?
What's that like?
So what'd you eat?
What did I
Probably
eat?
was scary.
Yeah, that is
What
really
did you? I
scary.
don't remember.
The brat diet?
Chicken.
Oh,
No chicken?
broth.
pureed everything. They said I would never have solid food again.
Oh.
Yeah.
Pureed
Bought a good
chicken.
blender and then.
You almost forget how to like swallow.
It's like baby food,
Food
basically.
or-
That's a good question.
Yeah.
Your point on baby food, like sometimes even to this day, the girls crack up because what I eat is my normal. I'm good with it, but truly, like when we reintroduced avocados, I was like an infant trying an avocado for the first time, right? And so my kids laugh still to this day. They like look at me and they're just like waiting for my reaction. Like, what is she gonna do? But it just,
You know, I love this about your family and you specifically because you do find humor. It's like your medicine. And, you know, this whole podcast, we've been joking and laughing, and people are probably like, Charity, shut up. That's so mean. Or stop doing that. But I know Jana and Scott, and I know that that's part of their healing. That's part of what their joy. And they like to like laugh at stuff because otherwise you cry? That's how I do things.
how else do you get through it?
Yeah.
Yeah. And it's, you know, I think it's really healthy to have a sense of humor and be able to laugh at the stuff that's funny. I mean, it obviously you're not in it now, so we can laugh at it.
Yeah.
In the time, that's, you know, don't invite me over because I might laugh. But yeah, I'm that person. Yeah. But, you know, I think it is something it's really important. So thank you for giving us that because it's
true.
comfortable to be able
Yes.
to laugh with you. And so thank you.
Yes. Thank you.
And even in the hardship though, like there really is so much joy. And I often look back and I'm like, how could all of this unfolded? We haven't even got to cancer.
I was going to say, we haven't even got to
We still have more.
Oh my God.
That's not all, guys. That's not all.
So, but I look back and I'm like, man, not that I ever want to go through this again because it has been horrible. We have lost family members. We have lost friends. We have been cancer ghosted. It's a real thing.
What does that mean?
Like
Oh, you get cancer? People just,
They drop
out.
No.
Yeah.
It's a lot. It's a lot for people. They don't know how to do it. They don't know how to
Yeah.
be with you. They don't
What do
know
you
what
say?
you need. They don't know that, you know, there's just like, they kind of just dip.
Yeah.
That's horrible.
Yeah.
It's wild. But I think that even with the cancer ghosting, that just shows that we're all going through our own thing. And so I think what I was going to say is like looking back on all of it, not that I want to go through any of it. I would never wish it upon anyone. I would never want to go through it again, but it has only strengthened our family. And, it's been really, really hard. But I think the biggest takeaway from all of it is society wants to label everything, but we don't have to label it. I was just talking to my mom
Well,
about
good luck labeling your stuff.
it. No, right?
Like, you can't slap one label on it.
But I was just talking to my mom.
All the above.
She's just like everything.
Own category. But I was talking to my mom about it the other day, and what if we didn't label everything though, and we just accepted grief as a normal human experience? It's not negative.
Oh.
But society thinks and labels it as negative.
Well, we've been conditioned for a lot of things.
Yes.
Yeah.
So that's what I think that people are waking up to now.
Yeah.
Is that we don't need, like, we're not going to be zombies to the TikTok, like, not, I don't really mean TikTok, but maybe I do. But, you know, like what is this called when you get put in a trance?
Hypnotized.
trance.
Yeah, when you get hypnotized. Like, I think that's been going on for a while. I for sure, in my generation, like, this has started a long time ago when we were little.
Yeah.
And probably before then. I'm quite a bit older than you, but I mean, like, it's been going on for a long time. And call it conspiracy, call it whatever you want, but it doesn't matter. It is how it is. Like, we've been programmed. And so let's that's what I've been trying to do, like, break the mold, break the thought process. And I think that you're right with that. Like, we don't need to label, everything doesn't need to be black and white.
No.
And the more you know, the more that's what's happening.
Yeah.
We're learning a lot more. We're opening our eyes, and the more you know and understand.
Yeah.
And look into things. I had my head in the sand for a long time about a lot of things because I wasn't interested. I didn't care. But the more that you look into things, you really need to be able to make your own decision on things. And like with medical things, it's not immune to, like, the doctors do the best they can. And I have a ton of friends that are doctors. They do the best they can, but they are not God.
Right.
And they don't know everything.
Yeah.
And so, you know, the more that, and that's what I've loved about interviewing, I don't know if you call it interviewing, it's way more casual than that, but talking to all of the beneficiary families, we're learning so much.
So much.
What we have learned in these 13 weeks, or let's say maybe 10, because we had a couple detours. But, you know, I hope everybody listens to it because you really need to take it all in and decide for yourself.
Right.
And so I love what you're saying about let's not label things. Let's just listen here and then treat people
So
like
true.
to know you. You there's not one label on you. I don't put one label on you. I don't look at you as a patient.
I don't either.
I look at you as
Me
as
neither.
Jana.
As Jana.
Our dear Jana. I don't see any of that, even though I know it all and I've heard it all a few times. You know, so
That's who you
But
are
you
to
don't-
me, for sure. You're Jana.
yeah. So I continue on with that, but I just love that you said that.
I really could write a whole book on it.
You could. You should.
I probably will.
You should. We promoted 2 books already. Let's get your book out there.
Yeah, so I just grief, like we end up, grief is never gonna step aside or move aside, but our capacity grows around it. And it just doesn't have to be a negative thing. Like, what if instead it wasn't like, oh gosh, she seems so down in the dumps, she's depressed. Like, take a step back, like, drop the judgment and just go sit in it with her, whoever her is. And like, just be there. Like, what's the one number one thing I always tell you when I get really, really frustrated? And as men want to fix.
Yes.
What do I say?
Well, normally it's either just sit here with me or normally it's don't try to fix it.
Yeah.
Because I'm very much a very typical, okay, this is the problem. How do I fix it? And then
It's kind of how you guys are wired. It's not your
Yeah,
fault.
100%.
But
yeah. But I think with all this, it's definitely, that's been the hardest thing for me is okay, she doesn't need me to fix it. She needs me to just sit there and just not even give her an opinion. It's just sit there and be like, okay, what do you need?
Right.
And I'll just sit here. But that's probably the hardest. And I think, you know, not trying to fix everything is hard for a lot of people, especially when you care for the person. You're like, I just want to make this better. But you know, it's hard to be like, okay, making it better is just sitting here and being with them, not necessarily trying to find a solution, because the solution probably isn't something that I can bring.
Right.
And I just gotta understand that.
You know what heals me every time?
What?
This man. He will take me for a walk. How far you want to go? 1 mile. Liar. We're going 5.
What?
Oh my god.
And then I'll just like word vomit all over him. And then I'm like good as new after.
Oh,
Just get outside, go for a walk.
That is so healthy to do too.
Yeah.
Like it just feels so good.
well, and Scott, it's
De-stress
super
and
admirable because
together.
obviously it's not easy, but you're listening and you're heeding like her lead, like what she needs, and I think that's, as you're saying, it's not easy, but you're doing it even though it's not easy, and that's super admirable, and I respect you for that.
Well, thanks.
That's
It was
amazing,
a
yes.
big learning curve, that's for sure.
Yeah.
Of
Because
course.
I think just generally like in life and in my work, I try to fix problems one way or another. And this isn't, and even, with kids, it's like, okay, if your kids do something wrong, okay, this is what you did wrong. This is the correct thing you should have done. So
Right.
let's not let it happen again. And that sort of thing.
Yeah.
And with something like this, like with grief, it's so much more, so much deeper and so much harder to like, there's not like a solution for it necessarily. It's just be with that person and listen to them. And, just like she said earlier, just either walk or sit and sit with them in it. And,
You know what I'm noticing, or I want to point out that you're using the word grief, and typically we use the word grief in death, right? So, Rhonda, it's Rhonda's husband's birthday, and she has to sneak out. She's
we
like, how
sing
do I
happy
just sneak
birthday?
out right now?
birthday, Rhonda's
So-
husband.
You guys.
So that's okay.
But I
Go
just
ahead. I have
don't
to
think
give her.
She can get out, is what I was telling her.
Oh, your car.
Yes.
Oh,
Yeah,
I'll get moved.
have Joe come get you. No, I think you're like way blocked in.
I'm way blocked.
Oh.
Okay,
I'll
I'll
move.
just have
I
Joe.
have both of our.
Well, my keys are in my car. Are your keys? Okay.
You're good.
Okay. Sorry, guys. We're gonna pause real quick while we get the cars out of the way.
Sorry, you guys.